my dear friend. Just one more time, if they say you are positive, you can take your treatment. HIV and AIDS is the whole world's problem.
I feel greatly honored and privileged for KMC to host the World AIDS Day 2012 on my behalf and on behalf of the Carnifing Municipality. I heartily welcome you all to KMC ground. We are aware that an estimated 33 million people are living with HIV worldwide. In the country, that is the Gambia, however, we are told that the prevalence, as per 2012 Sentinel survey, is 1.67%, and estimated 28,268 people are living with HIV virus. Chairperson, distinguished ladies and gentlemen, as you are aware, in KM, Carnifing Municipality, we have about 30% of the population of this country and continue to face rapid population growth as a result of rural-urban migration and the concentration of other migrants of different nationalities. In addition, we are aware of the fact that good numbers of the support societies are housed within the municipality. We at the Carnifing Municipality and the Banjul City Council will give our support to the government of the Gambia under the dynamic leadership of the President, Sir Professor Alhaji Dr. Yahya AJJ Jammeh, to scale up towards universal access to HIV prevention, treatment, care, and support. Our strategic approach is to emphasize prevention rather than cure. This is because prevention is less expensive, cost-effective, and sustainable. Through our programs of awareness in schools, marketplaces, and all other public gatherings, the dangers of the pandemic should be made known to all and sundry, so that the incidence of AIDS can be reduced to zero.
The World AIDS Day campaign focus on getting to zero signifies a push towards greater access to treatment for all, and a call for governments and all stakeholders to act now. So our being here is a show of our readiness to act now. Not only can governments do it alone, each and every one of us have a stake and a role to play in this crusade. If you look at the theme this year, Getting to Zero, one component of it looks at stigma and discrimination. And in that area, even those that are living with the HIV can play a very important role, because we have what we call self-stigma. If you feel you are being stigmatized or discriminated against by virtue of your status, it is very real in some situations, but in some cases it is an assumption by the individual himself or herself.
I am with a great pleasure to stand here today on behalf of Gambia Network of AIDS Support Society, GAMNAS, and all the people living with HIV and support groups around the country to express our sincere appreciation and gratitude to you all on the commemoration of World AIDS Day 2012. The theme for World AIDS Day, Getting to Zero, remain unchanged and will continue until 2015. Zero new HIV infection, zero discrimination, zero AIDS-related death. The World AIDS campaign focuses on zero AIDS-related death, which signify a push towards greater access to treatment. Call for action. There are more people living with HIV today than before. There are also less new infections today than before. There are more people on antiretroviral treatment than before in the Gambia. There are more than 3,000 people living with HIV on antiretroviral therapy. We are therefore very grateful to government and its partners, such as the Global Fund, the UN agency, the civil society, and all the support in making life savings available free of charge.
Thank you very much.
On World AIDS Day 2012, the Gambia joins the community of nations to remember all women, men, children, and young people who have lost their lives to HIV and AIDS. Also on this day, the Gambia government, under the dynamic and visionary leadership of nobody other than His Excellency, Sir Professor Alhaji Dr. Yahya AJD Jammeh, whom we all know as the nation's health as his key priority. In 2011, there were 600,000 less AIDS-related deaths than there were in 2005. It means we have made progress in defeating this very tough battle that we are fighting globally. HIV and AIDS continue to pose a major threat to our development and the lives, health, and well-being of the individuals, women and children in particular. National AIDS Secretariat, NAS, and the Ministry of Health and Social Welfare continue to spearhead the HIV and AIDS national response in partnership with other stakeholders like ActionAid. The government of the Gambia will remain committed to the creation and enabling environment through concrete actions and policy engagement with a view to strengthening the gains made in the national response to HIV and AIDS. The government of the Gambia is acting on its promise at the 2006 United Nations high-level meeting on HIV and AIDS to scale up universal access to HIV prevention, treatment, care, and support. In this regard, we are already providing universal access to antiretroviral treatment as well as PMTC services in the regions. As of date, 10 ART centers and 33 PMTCT sites were established. Also, the government of the Gambia recognizes the overall dire need for support in strengthening health systems in drive to getting to a zero new infections, zero HIV stigma and discrimination, and zero AIDS-related deaths in the Gambia. I therefore urge each and every one of us to show solidarity and compassion to those already infected and affected and are living with HIV/AIDS. Remember, your friend, your loved one, your family member living with HIV/AIDS still remains your friend, your family member, and your loved one.